Tyler Green, and I'm an interventional radiologist at RIA Endovascular. So today I'd like to talk about prostatic artery embolization, or PAE for short. Common symptoms of BPH might include the sensation of not being able to completely empty your bladder, getting up frequently at nighttime to urinate, having a weak urinary stream or difficulty initiating a urinary stream, and these symptoms can become significantly bothersome for men. The first step in determining what procedure is going to be best for a given person is to undergo an evaluation by a urologist. The urologist is a specialist in the genitourinary system, which includes, among other organs, the prostate gland. So they can actually look at the prostate and do very specific testing to determine how large is the prostate, in what shape is it enlarged, and also to be sure that the urinary symptoms a person is experiencing are in fact coming from an enlarged prostate as opposed to a problem with the bladder, for example. So after a urologist has evaluated the prostate and determined that the enlarged prostate is causing the symptoms, then they can talk to you about what treatment options may be available. As I said before, there's a wide variety of treatment options that can be used for an enlarged prostate, and PAE is one of the many options available. Once the prostate becomes very enlarged, many of the minimally invasive treatment options that a urologist could offer are no longer on the table. Many of the minimally invasive treatment options that a urologist can offer require that the prostate be under a certain size. In a very large prostate, however, we can consider doing a prostatic artery embolization, and that may in fact be one of the best or potentially the best treatment option. Other situations where PAE should be a leading consideration would be in patients who are on blood thinning medications that can't be safely withheld to undergo prostate surgery. The very nature of PAE is such that we're shutting down blood flow to the prostate, and that's actually going to decrease bleeding and decrease bleeding risk compared to procedures performed by a urologist who's going to be actually cutting out tissue from the prostate gland and may carry a higher bleeding risk. Prostate artery embolization, or PAE, is a procedure in which we shut down the blood flow to the prostate gland, and that causes the prostate gland to gradually shrink or decrease in size. The procedure is performed by injecting very small particles into the arteries that supply blood to the prostate, and those particles are injected through a very small catheter that we insert into the prostate artery. So the PAE procedure is performed as a day procedure. People go home the same day as the procedure. The vast majority of people go home without a bladder catheter in place. And the recovery is generally quite tolerable. Patients tend not to have significant pain after the procedure. And really the most common side effects of the procedure would be some bladder irritation that can last for a few days afterwards but resolves on its own. If you feel like prostate artery embolization may be a procedure for you, talk to your urologist and visit our website.